This video is about ginger and why it is an important anti-inflammatory spice you can add to your food, your meals, and also taken as a supplement. So if you go hunting around now during the COVID era and you're wanting to know, will ginger be helpful? It's really not a good question because these are basically scientific questions. And so the answer is you're going to find out will be this. Ginger is not preventive or curative for COVID-19, and really nothing else either. Just adding a little bit of ginger is not going to cure a chronic disease or prevent the cytokine storm if you have a nasty COVID scenario. So we need to understand what this language means in the proper context. So let's look at what I'm referring to. So here's a paper published in 2019, and you can see the bioactivities and bioactive compounds in ginger. So here are some of the beneficial bioactivities. You can see anti-inflammatory, antioxidant activity. So this is beneficial. The odds, though, that the activity of taking a couple grams of ginger or turmeric is going to just cure chronic disease like heart disease, diabetes, or just make COVID go away or the flu go away, that's not how these things work. So when you see anti-obese activities, because they're anti-inflammatory effects. And you can see anti-nausea, cardiovascular. So cardiovascular, respiratory, neuroprotection, diabetes, cancer, and microbial, you're all talking about anti-inflammatory benefits for the most part. So what it does is it shifts the body into a less of an inflammatory state by taking ginger. Now, will this be enough to impact symptoms? You won't know until you take it, and it depends upon how much too, and I'll show you what I mean about that in a couple seconds. So what is it in ginger and other herbs like famous anti-inflammatory ones like turmeric and boswellia that allow for the anti-inflammatory activity? And the reason why they're able to is because they contain substances they're called phenolic compounds. Some are poly, other are just single phenols. I'll show you what I mean. So here are some examples. Now, back when I was going through school, we called this whole thing bioflavonoids. Now they're called polyphenols as a general family. So in this family, you can see single rings. So this would just be a single phenolic substance. And here you have multiple rings. So these rings are phenolic rings. So here you can see a polyphenol. So these are the beneficial compounds in your vegetation. So fruits, vegetables, spices. Anything that comes out of the soil is going to contain polyphenols that are anti-inflammatory. So this is some images of the anti-inflammatory phenolic substances in ginger. This was published back in 2015. You can see their names: Shogal, gingerol, paradol, zingiberine. I've always had trouble saying this one down here, but anyway, you can see what it says here. Here, this one's easier. Zingerone. So these are the polyphenols, or the polyphenols, the phenolic substances that we get from ginger, which have the beneficial anti-inflammatory effects. So what kind of outcomes could we expect? Well, when it comes to the whole COVID thing, you already saw, I mean, it's really not the best way to look at it, but it has been used as a therapy for musculoskeletal pains for a long time. So let's look at this. This is from back in 1992. So these 56 individuals, these people were living in Denmark, and if you've ever been to, and this is back in 1992, and so I was in Denmark, when was I in Denmark? Around 2010-11, so only 10 years ago, 2020 now, almost 2021, and a lot of lean people there. So way earlier than that, so another 20 years before that, you're talking about even less obesity. The reason why I'm saying that is because the better chance one has to respond to a botanical or medication is if they're less chronically inflamed, and obesity is the biggest chronic flamer that we know of, coupled with hyperglycemia. So these researchers, what they did is they communicated with 56 patients who were taking ginger for 3 months to 3 years and longer in some cases. Who were these people? What do they have? Well, 28 had rheumatoid arthritis, 18 had osteoarthritis, and 10 just had muscular discomfort. And they all just took either powdered ginger that you can get from a spice shop or from the grocery store, the health food store, or they used, one guy used fresh ginger that he cut up and put in meals. So you can see the outcome in general here. More than 75% experienced to varying degrees relief in pain and swelling, which means that 25, well, less than 25%, so who knows what it was, probably between 20 and 25%, had zero beneficial effects. So this is the way these herbs work and spices. You take them, and now if it didn't work for me, I'd still be taking it. I would just be doing other things. So, but for some people, in this case, 75% or more, had beneficial effects. So all the patients with muscular discomfort experienced pain relief, and none had, this is the biggie, none had adverse effects, which is a huge issue because when you're talking about non-steroidal anti-inflammatory drugs, well, what they can do is eat up your gut pretty bad. So this is an 80-year-old woman. Okay, 80-year-old woman. She already had a kidney removed prior to taking the ginger. So she consumed ginger for the last 3 years. First 6 months, she took 6 grams per day. And then in the last 2.5 or so years, she took 2 grams per day. So you can see she tolerated this dose without any side effects. She felt relief in symptoms and kept taking it regularly. So for someone who's got kidney disease or has lost a kidney, NSAIDs taken chronically can cause, so this is acute kidney nephritis, kidney inflammation. Now this can happen for lots of people taking NSAIDs. When they stop, it gets better. But the fact of the matter is that if you want to have pain relief and you're 80 years of age, you don't want to trash your kidney, particularly if you only have one, obviously. So this woman was advanced age. She had 1 kidney, took ginger for 3 years, which means that unlike anti-inflammatory drugs, non-steroidal anti-inflammatory drugs, ginger does not impair renal perfusion, renal blood flow, or renal function, especially in the elderly. So what a great outcome for this 80-year-old. And how expensive is ginger? It's like $5 a pound for organic ginger at a health food store. So it's a great deal. Here's a 49-year-old male, muscular pain and pain in some joints about 5 years ago. His job, I'm going to sneeze. Not going to stop the video. Excuse me. Gesundheit. So his job involved physical labor for several hours per day. So I did sneeze in the COVID era. Yeah, allergies. Sorry. So he had GI distress due to taking NSAIDs. At times he would even be in bed with such pain. So his friends said, why don't you just try taking a teaspoon of powdered ginger a day? In 14 days, marked reduction, and within 1 month, all of his pain was gone. So a pretty fantastic outcome for this almost 50-year-old. Here's a 70-year-old, almost a 70-year-old woman. And since she's had back pain for 17 years, she also had pain in her neck. Several joints had X-ray imaging showing osteoarthritis. A decade later, she started to get pain in her hands. She got pain in knees and elbows. And she was concerned about having stomach irritation by taking the drugs for a long period of time. So she brought in a sample of her ginger, and this is her powdered ginger. She took this much a day, sometimes, up to 8 grams per day. Now, the amount that the average person is recommended to take in terms of supplementation is about 1 to 3 grams per day of your various spices. So after 4 months on ginger, she noticed relief of symptoms. Right knee pain was gone completely after 2 months, but her other pains did not go away. After 6 months, she stopped taking all anti-arthritis drugs, which we know, of course, can trash your kidney and your gut. So what a great outcome, just taking a few grams of ginger, well, more than a few grams per day. So this is a 50-year-old guy. And look what he did. He ate 50 grams of raw, fresh ginger daily, first month, after diagnosis, in lightly cooked vegetable and meat dishes. So after 1 month, he had relief. He was completely free of pain and swelling after 3 months on ginger. This guy's a mechanic. So he's had 13, 14 years pass without relapse of symptoms. Since last year, he's got nodules on some of his joints, but he is still without pain. So that's pretty impressive how powerful ginger can be for certain people. So again, what's the amount that you would take? Well, you would take pretty much 1 to 3, 1 to 2 grams per day is a typical recommendation, because a healthy vegetable-rich diet, mostly vegetarians achieve this amount because they eat more vegetables, or vegans achieve this amount. But you need to eat enough vegetables to get about 2 grams per day. So let's take this information in the context of what we just talked about. We just talked about joint and muscle problems. So if you were to take the deflame approach, what would you do? You want to get your weight normal, get your glucose levels normal, get your vitamin D level normal, take vitamin C, zinc, and other substances that you might like. For example, we talked about ginger. If you've got osteoarthritis, chondroitin glucosamine. We've got to replace refined food calories with vegetation. And then, so here are the deflame books that can help you. Obviously, if you're overweight, you got to get your head right. Learn about how a pro-inflammatory diet knocks out joints and other musculoskeletal tissues, and then overall anti-inflammatory eating issues are discussed here. So now, the way we look at it in the deflame world is you can see here, to improve joint, muscle, and bone health, you basically do 1 through 5, right? Get your weight normal, glucose, D, key supplements, and get rid of refined food calories, replace with vegetation. Okay, so let's say we're in the COVID era. What are we going to do? Well, same thing. All I did was just replace the book. What are the recommendations? Get your weight normal, get glucose normal, get D normal, take C and zinc. You can take ginger too, anti-inflammatory. Replace refined food calories with vegetation. So this is the deflame approach. Basically the same approach applies to everyone because all of our problems that we suffer from health-wise is due to chronic inflammation. I just did a video on fertility. So what would you do there? Well, same thing. You want to become fertile? Get your weight normal, get your glucose levels normal, get your vitamin D levels normal, take C, zinc, other anti-inflammatory supplements like ginger, replace refined food calories with vegetation. Here's how you get your body weight normal, and here's the deflame approach to eating. So no matter what the name of the condition is, you could put anything that you want there and you have the same basic approach. How easy and straightforward is that? So if you like this approach and you want to get single copies of the books right from Amazon, or you can go to deflame.com and get volumes of volume discounts on any and all of these books. And of course, up here, you can like and do all that people recommend that they do on sharing and all that business, and liking Facebook and the YouTube channel if you like this information.